You're listening to A Small Dose. I'm Dr. Charlene McCormick, a registered pharmacist, and I'm here to provide you information on medication treatments for various diseases. My goal with this podcast is to provide you the information you need about your medication so you can make informed decisions and be in charge of your health. Disclaimer: the materials and content provided in this podcast is intended for general information only and are not to be considered a substitute for professional medical advice, diagnosis, or treatment. Hello, and welcome to A Small Dose, where we aim to provide you with the information you want to know about the medication you're prescribed. Today's Small Dose is all about oxycodone. Oxycodone is approved for use in pain management. It is considered an opioid, which is a term used to describe narcotics, both natural and synthetic. Oxycodone is a semi-synthetic product. This medication works by blocking your perception of pain. So here is the breakdown on how this works. There are receptors all over your body called opiate receptors. Many of them can be found in your brain, spinal cord, and gastrointestinal tract. Oxycodone and other narcotics attach to these receptors, and then they copycat the pain-relieving effect of some chemicals that your body naturally produces. Oxycodone does not actually address or fix the cause of pain in your body. It just blocks the pain signals. You may know oxycodone by a few different brand names. These include Oxycontin, Roxicodone, Roxybond, Oxedo, and Xtampza. It is available as both immediate release and extended release formulations. I mentioned in a previous podcast that the difference between immediate release and extended release have to do with the time it takes for the medication to dissolve and be absorbed into your bloodstream. Generally speaking, you take an immediate release version more times in the day than an extended release version. With oxycodone, the extended release version is generally dosed every 12 hours, while the immediate release version is dosed every 4 to 6 hours. Extended release version should not be chewed, broken, divided, crushed, or dissolved. Also, the extended release versions of oxycodone should not be used as an as-needed pain reliever. They are intended for pain severe enough that around-the-clock, long-term pain management is required. Oxycodone is also available in combination with acetaminophen, ibuprofen, and aspirin. Oxycodone is a strong pain reliever and is generally reserved for moderate to severe pain. It is 1.5 times more potent than morphine. What that means is 10 milligrams of oxycodone is equivalent to 15 milligrams of morphine. It is a controlled substance, which means that there are some strict federal laws that must be followed for prescribing and dispensing this medication. States also have their own set of laws for controlled substances, and the stricter of the two must be followed. How this affects you is there may be restrictions on the quantities prescribed at one time or how soon it can be refilled. Oxycodone can have some serious side effects and adverse reactions. Some of the common side effects include dizziness and drowsiness, headaches and itching, and even nausea, vomiting, and constipation. The more serious effects center on what's known as central nervous system depression. Your central nervous system controls important functions like heart rate, breathing, and alertness. The depression portion of this, as the name implies, means that those functions work slower, leading to breathing problems and lower heart rate. Death is a real risk as a result of lowered breathing and lowered heart rate. The CDC reported in 2015 that drug overdoses accounted for a little over 54,000 deaths in the U.S., 63% of which involved an opioid. Almost 15,000 of those involved a prescription opioid. I don't mention these statistics to be dramatic, but you need to realize the real-life consequences related to this medication. Prior to being prescribed oxycodone, your doctor should assess your risk by considering your other disease states and current medications, as these can influence your risk of CNS depression. Patients that are found to be at greater risk to stop breathing may be prescribed a medication called Naloxone. This medication can temporarily reverse the effects of oxycodone and other opiate medications, which can allow your breathing to improve. Many first responders like police officers and firefighters now carry this medication because overdoses have become so prominent and they are many times on the scene prior to the ambulance arriving. If you are prescribed naloxone, it is important that the people you live with know where you keep it and how to use the device. I mentioned that alertness can be affected. Increased sedation can impair your reaction time and thus affect your ability to drive or operate machinery. By law, it is considered driving under the influence if you have an accident when taking oxycodone. It is not a defense that you take the medication as prescribed. If your driving is impaired in any way, you can be arrested. I'm still not done with side effects. I also mentioned earlier that there are opiate receptors in your gut. This is why constipation is associated with opiates. Oxycodone will attach to receptors in your bowels and it will slow down motility. This increases the amount of time that food spends in your bowel, and when this happens, your intestines absorb more fluid, causing your stool to be hard. When you are taking oxycodone chronically, it is a good idea to also take a stool softener to prevent things from backing up. Okay, let's move on to some warnings. There are some other important warnings I want to discuss when you're taking oxycodone. Addiction is a major concern when taking opiates. Most people think of illegal substances when they hear the word addiction, but this can happen even when you are taking your medication as prescribed. Here's a very basic explanation of how this occurs. When you take oxycodone or other opiate-based medications, your brain records feelings of pleasure from the medication. This will cue these feelings again when you take the medication again. As you take it more often in higher amounts, the drug is not as effective as it once was in the beginning. Your brain still wants the pleasurable feelings, but your brain and body also want balance. So as this is taking place, you start to make less of your own natural opiates to balance out the presence of the chemical ones you took. Now you are less responsive to the opiate medication. What essentially happens is the reward system and tolerance form a cycle which encourages increasing opiate use. Eventually, you are no longer taking the medication to feel good, but to keep from feeling bad and to prevent withdrawal. Some of the withdrawal symptoms include nausea, aches and pains, tremors and chills, and restlessness. Addiction is not based on your willpower or weakness. Anyone can become addicted. Addiction does not mean you're a bad person, but it can lead you to make bad decisions. If you feel like you have become addicted to oxycodone, please reach out to your doctor or local addiction specialist for help. The next warning I would like to discuss is the use of oxycodone during pregnancy. If you become pregnant while taking this medication, you need to have a serious conversation with your prescribing physician and your OBGYN about the need to continue using it. Oxycodone does circulate to the baby and can have negative consequences like birth defects, poor fetal growth, and preterm labor. Use during pregnancy can also lead to withdrawal syndrome in the baby. Your doctors can work with you to devise the best plan to wean off of the medication and to help find alternative treatments to manage your pain during pregnancy. Now, I also want to briefly mention drug interactions. You really want to avoid taking anything that can also cause sedation when you're taking oxycodone. Medications like Valium and Xanax can increase sedation and impact negative side effects. This also includes alcohol. It would seem like common sense to avoid drinking alcohol when taking oxycodone, but there are people out there that don't realize you shouldn't drink when you take your pain relievers. Alright, we're almost done, but not before we get to the cost. Both the immediate release and extended release versions have generic options. Let's first compare the immediate release options. Generic oxycodone can cost as little as 37 cents to $2.50 per tablet based on the milligram strength. Roxicodone is $2 to $12.25. Both Oxydo and Roxybond cost from $8 to $12 per tablet. Now for the extended release versions. Generic oxycodone ER costs $3 to $17.25. Again, the wide range has to do with the tablet strength prescribed. So the 10 milligram strengths are on the lower end and the 80 milligram tablets are on the higher end. The brand Oxycontin runs anywhere from $4.50 to $25.20. Xtampza runs from $4.85 to $15.55. It is difficult to provide what it would cost an average prescription because the quantity needed will depend on how frequently your doctor instructs you to take this medication. These prices are based on average wholesale price, so the actual cost to you may vary depending on the pharmacy's pricing, but this will give you an idea of what to expect. Alright, thanks for sticking with me through this podcast. I hope you enjoyed your small dose about oxycodone. Tune in next time for another small dose. Look for us on Instagram, Twitter, or Facebook. Check the description box for links. And as always, leave a comment if there are any medications you want to learn more about. I'm Dr. Charlene McCormick, and thanks for listening to A Small Dose.